My name is James Robson. I'm Chief Medical Officer for the Scottish Rugby Union. I've been asked to talk at the scientific conference this week on my role as a team doctor in international sport, in particular, in my case, rugby. I came into sport almost haphazard. I trained as a physiotherapist, then trained as a doctor, trained as a GP with a special interest in sport. I care passionately about pitchside care, and I was using this talk to illustrate the practice of emergency medicine at pitchside, in effect, instead of in the ED department, in the field. Rugby is a contact sport. The game is allowed to continue despite injuries occurring. That allows the medical team to access the field of play. That in itself creates a danger and a problem. You have to be aware of the dangers to yourself, to the player that's down injured, and you also then have to make a very quick, often split-second decision as to the viability of the player playing on. That is where training takes part, but it's also where knowing your players and actually just having that doctor's sixth sense in deciding whether a player can play on or not is very, very important. I've illustrated the breadth of pitchside medicine. You have to be a travel doctor, a GP, you have to be a minor surgeon, but you have to be an emergency medicine specialist to a certain extent as well. Never more so than in an injury involving the rugby star Tom Evans. He dislocated his neck. He was extricated from the field of play and operated on that night. He is now starring in screen and stage, and to a large extent his full recovery is down to the training that those people attending to him at pitchside gained. That is the take-home message that I'd like you to understand for pitchside care, and indeed for any care of any patient, that training can help. Practice makes perfect.